us this morning is former Assistant FDA Commissioner Peter Pitts. Good morning. Thanks for being with us. What do we know about the FDA's role in getting Abbott to halt production?
Well, most importantly, the FDA went to inspect the Abbott plant in February, and it was a disaster. It absolutely had to be closed. Safety problems, quality issues. They were hiding problems from the FDA, a real culture of noncompliance. It would have been a regulatory malpractice to leave that plant open. To the FDA's credit, they reached out to the other manufacturers to get them to ramp up production, and that certainly has helped to mitigate the shortage. But they didn't communicate. They didn't reach out to pediatricians. They didn't reach out to parents. And the question now becomes, what did the White House know, or did they even understand what was happening at the time?
Yeah, and Dr. Califf also brought up the potential need for a national stockpile of formula as a backup. Was this ever a discussion before?
Well, the FDA, across its portfolio of regulated products, both food and medical products, there are a lot of those that are manufactured in a consolidated manner, meaning there are only a few manufacturers. And what the FDA really needs to do across its portfolio, including baby formula, is to understand what might happen if a plant shuts down because of safety issues or an earthquake or, God forbid, a terrorist attack, and have a plan in place. So we're not dealing with these things on an ad hoc basis.
Right, and we talk about, this issue at large that's really highlighting it. It's formula now. It could be something else in the future. How can the FDA pay better attention to these food chain disruptions?
Well, relative to the food center at the FDA, it's horribly underfunded, and Dr. Califf mentioned that a number of times. Hearings both in the House and the Senate, I think members recognize the FDA needs more money for its food center, but money only goes so far. We also have to make sure that food gets as much attention inside the FDA as medical products does. The F in FDA should not be silent.
Oh, well put. 2 shipments of formula have come in from Europe. Will there be more, and where will they be going?
I expect that there will be more. The first shipments are from Nestle, from Switzerland through Germany to the U.S., were for babies with serious metabolic issues. And those are going to reach those families as quickly as possible. The reason they went to Indianapolis, speaking of the race, is that's where the Nestle's distribution center is. But there are other types of products that most parents use that will be coming in, and it will help a little. It isn't really going to help a lot. You can only fly in so much, but it's certainly, something that needs to be done. And the FDA really should have thought about this back in February rather than thinking about it 2 weeks ago.
Right. What would you be doing right now if you still were in that position?
Well, I'd be reaching out to Abbott, asking why they didn't admit in congressional hearings that there's a culture of noncompliance at the Sturgis, Michigan facility. It's nice to say nice things like every member of that factory is making baby formula like they're giving to their own child. Unfortunately, it's not true. So I would be leaning on industry to be much more open and transparent with the FDA on a regular basis, even if the FDA doesn't have that authority, at least at present.
And what areas in the United States are in the most desperate need right now for formula?
Well, clearly, rural areas are at the highest risk because you can't just go to one store and then drive 5 minutes to another store. There oftentimes is only one store. So you've got rural farming areas, you've tribal areas as well, and we've got to pay special attention to their needs.
All right, Peter Pitts, thanks so much for being here this morning.
My pleasure. Thank you.